complications. Well, there's something we're hearing a lot about lately, feeling social anxiety, going back into crowded places. It's affecting a lot of people. If you're feeling it, you are not alone. Joining us to talk about this is Dr. Newfield, Chair of Psychiatry at Hartford Healthcare St. Vincent's Medical Center. Doctor, welcome.
Hi, Ms. Carberg. How are you?
I'm fine. Thanks for being with us. So how might a person with social anxiety have processed or coped with the last year of lockdown, quarantine, and social distancing differently than someone without social anxiety?
Yeah, for a small percentage of people, and we're talking around 10 to 15% with severe social anxiety disorder, going out and being around people as they might have been previously was a difficulty and something that they really tried to avoid. And so for these people, being under lockdown and being less engaged socially was a lot easier for them, and they sort of, I guess, stopped doing some of the work that might have been involved with the challenges of getting out there and doing the things that, you know, a lot of us took for granted. So they stayed at home happily.
All right. Yes. Talk about now they have to go back out and reopen. And what are the challenges for them now?
Sure. It's a little bit more challenging for them than for other people. I think we're all kind of getting used to the new realities and maybe being uncertain about, you know, what it's like as much to be around people, seeing as how it's been almost a year. But for these people, they're going to have to, you know, think about it and push themselves a lot harder than the average person, and that might involve getting some help.
Oh, excellent advice, and there's a lot of help out there. Are there any coping mechanisms or tools to help people who are anxious about a return to more social situations?
Certainly, I think that a lot of behavioral therapists are able to help work through these situations with people and teach them things like breathing techniques or different ways that they can teach their minds to think about what's, you know, daunting or challenging for them. But certainly reaching out to those therapists or friends that might be able to help someone get to that stage is probably the first step if they can't handle it themselves.
All right. How does someone know if their anxiety about a return to social gatherings in the workplace also is normal or cause for concern?
Sure. I think once you're starting to avoid some of the vital things in your life, if you're a student and you're avoiding going back into the classroom, if you're a professional who has to get back to the office and it's having an impact on your work and your ability to provide yourself with means, certainly those are things to clue you in. If the anxiety about it, even if you're able to do those things, is causing you disruptions in your sleep and in your appetite and some of your activities of daily living, then those are good ways to sort of be aware. Sometimes it's tough for us to know these things for ourselves, and so at that point we want to, you know, listen to those around us that might be sort of cluing us into, I'm a little bit worried about you, or maybe you could get some help. So listening to others is also a key way to know besides those other ways.
You can always start with your general practitioner, too. They're so good to listen to. All right, Dr. Newfield, thank you so much for joining us. Good information.
Thanks to you.
Thank
Bye.
you.